Imagine, just for a moment, that you're paying for a safety net.
Right.
Year after year, you pay your monthly premiums, assuming that if you ever fall, this net is going to catch you.
Mm-hmm.
But then you look a little closer and you realize that the net isn't made of rope at all. It's actually like this highly sophisticated billing algorithm.
Yeah, and it's not looking out for you.
Exactly.
Mm-hmm.
Instead of being designed to catch you, it's been optimized to profit off your personal data while, actively looking for ways to limit the actual care you receive.
It's a terrifying realization, honestly.
It really is.
Because we inherently want to believe that healthcare is a sanctuary, right? A place where clinical need is the only thing that dictates the outcome.
Right, of course.
But when you pull back the curtain on modern integrated healthcare, what you often find is just a massive financial machine wearing a stethoscope.
And today, we're pulling that curtain all the way back, so welcome to the deep dive.
Glad to be here.
Our mission today is to unpack a massive, honestly, almost overwhelming stack of federal audits, court settlements, and recent medical meta-analyses from early 2026.
That heavy stack.
Yeah, it really is. We are looking at a staggering picture of institutional healthcare fraud, specifically zeroing in on Kaiser Permanente.
Mm-hmm.
And from there, we'll be exploring the explosive political and legal civil war currently raging over COVID-19 policies and vaccine safety.
Which is an immense amount of ground to cover.
Oh, absolutely.
And it touches on some of the most sensitive, fiercely debated nerves in our society right now.
Which is exactly why we need to set the stage very clearly right up front.
Yeah, good idea.
The sources we're looking at today contain highly charged political and medical debates, and I want to be explicitly clear to you listening, we are not taking sides.
Right, no sides.
We are not endorsing the viewpoints of the politicians or the lawyers or the medical reports we're about to discuss. Our role today is strictly as an impartial guide.
Just the facts?
Exactly. We are here to convey the documented facts, the lawsuits, and the scientific claims contained in the provided source material, period.
Yep.
Okay, let's unpack this.
Well, let's start with how an institution views a patient on paper.
Oh.
Because how a system defines you in its database, that basically sets the entire foundation for how they treat you in reality.
Right. And that brings us to January 2026 and this record-breaking settlement.
Yeah, a massive one.
The documents show that Kaiser Permanente agreed to pay $556 million to resolve allegations of Medicare Advantage fraud. And the core of this was a practice called upcoding. But, how does that actually work in practice?
So upcoding is a term that sounds like a minor administrative typo, right? Like somebody just hit the wrong button.
Yeah, exactly.
But the mechanics of it are incredibly deliberate and systemic. Under the Medicare Advantage program, the government pays health plans a flat monthly amount per patient.
Okay.
But that amount goes up if the patient is sicker. This is known in the industry as a risk adjustment score.
So if I'm a patient and I just have, basic diabetes, the government pays the health plan one base rate.
Precisely. But if your chart says you have diabetes with severe complications, the plan gets paid significantly more every single month.
Wow.
Yeah. And according to the Department of Justice complaint in our sources, Kaiser didn't just passively receive these diagnostic codes from doctors.
They went looking for them.
They actively mined patient data. They built and deployed algorithms to scour through past medical histories, looking for literally any possible excuse to increase a patient's risk score.
That's wild.
And then the system would retroactively send queries to doctors, pushing them to add severe, unsupported diagnoses to a patient's chart.
Just to get the payout.
Right. And this was happening sometimes months or even a full year after the actual medical visit.
Wait, hold on. I'm confused. If an algorithm is just inventing severe complications out of thin air, wouldn't the doctors push back?
You'd think so.
Didn't anyone hit the brakes on this?
Well, that is where the whistleblower comes in. Dr. James Taylor, a longtime Kaiser physician, provided testimony detailing how doctors were actively pressured.
Oh, wow.
Yeah, it wasn't just a polite request from the administration. Doctors were incentivized with financial bonuses to add these algorithmically generated fake diagnoses.
That's a huge conflict of interest.
Absolutely.
Yeah.
And if doctors underperformed on these coding metrics, they were singled out.
And the administration knew about this, at the top.
Oh, yeah. According to the complaint, Kaiser officials ignored numerous internal warnings from their own compliance personnel.
Wow.
People were raising red flags that this practice was straight up unlawful.
I cannot get over the fact that the patients had absolutely no idea this was happening. No one was informed that their permanent medical records were being altered to make them look sicker than they actually were.
Nope. Completely in the dark.
It's like going to a mechanic for an oil change, and then the mechanic secretly charges the government for a rebuilt engine. But it's actually much worse, because that fake rebuilt engine goes onto your permanent health record.
Yeah, that follows you.
Right. If they're willing to invent illnesses just to get paid, what happens when a patient is actually sick?
Well, we connect this to the bigger picture. This exposes the fundamental structural flaw of what the industry calls value-based care models.
Okay.
The institution prioritized its risk adjustment scores over clinical transparency.
Yeah.
They essentially treated the patient's medical chart as a revenue stream, a financial asset to be optimized, rather than a clinical tool meant to track actual human health.
And the exploitation of data doesn't even stop with billing fraud. The sources highlight serious privacy violations, too.
Oh, yes.
Kaiser recently faced a $46 million class action settlement. What exactly were they doing with patient data on the back end?
Well, they were sharing authenticated, logged-in patient data with third parties like Meta and Google.
Just giving it away.
Basically. We were talking about names and sensitive medical search queries being transmitted via hidden tracking pixels embedded right in the patient portal.
That is so invasive.
It is. Add to that another $10.5 million settlement just for harassing patients with marketing texts.
And these were people who had opted out, right?
Exactly, after those patients had explicitly opted out. It paints a picture of a system that views patient data as a highly lucrative commodity.
So we have the illusion of care, where they invent diagnoses on paper to boost revenue. But let's shift to what happens in reality when a patient actually needs help.
Yeah, this is where it gets really dark.
Because reading through this stack, when a patient's recovery stops being profitable, the system's language suddenly changes.
Language is an incredibly powerful tool for denial.
Yeah.
When a patient requires ongoing physical, speech, or occupational therapy, insurance plans often look for a linguistic off-ramp to stop paying.
The documents show California regulators accusing Kaiser of categorically rejecting therapy by abruptly labeling a patient's recovery as a, what was it?
Yeah.
A plateau.
Plateau. That is the magic word.
Wow.
They take a skilled therapy need, something a professional needs to guide you through, and suddenly rebrand it as just custodial or maintenance care.
And the moment they slap that maintenance label on it, the financial coverage completely vanishes.
It's a linguistic sleight of hand. The patient hasn't stopped needing the therapy. Their body hasn't fully healed. The system has simply redefined the need out of existence to protect the bottom line.
Which brings me to this tragic case in the files about a patient named Smith.
Oh, yeah, the wheelchair case.
Yeah. She needed a medically necessary motorized wheelchair, but her coverage had a hard cap of $2,000. I mean, I don't know much about medical equipment, but a custom power chair has to cost way more than that, right?
Oh, significantly more. A necessary power chair can easily cost upwards of $15,000.
Wow.
And because of that arbitrary $2,000 cap, she was forced to try and hold her failing wheelchair together with screws she bought from a local hardware store.
That is infuriating.
It really is.
Buying insurance with these hidden caps is like buying a parachute that is legally capped at 500 feet.
That's a great way to put it.
The exact moment you actually need it to save your life, the coverage just turns off.
Yep.
And the systemic limitation bleeds right into mental health care, too. The sources cover a massive strike where over 2,000 Kaiser therapists in Northern California walked off the job. What triggered that?
So the crux of that dispute is both fascinating and, honestly, dystopian.
Okay.
The union accused the organization of trying to replace human clinical assessments with AI chatbots.
AI chatbots. For someone in the middle of a mental health crisis,
Yes.
how does an algorithm assess human despair?
Well, it doesn't do it well. Which is why the documents contain heartbreaking anecdotes of patients waiting weeks for basic care, leaving families in total distress.
Just talking to a machine while they wait.
Right. The situation became so dire that the state of California actually had to step in.
Really?
Yeah. They fined Kaiser millions of dollars, which was part of a massive $200 million corrective action plan. And it was specifically for failing to meet the legal 2-week access timeline for mental health patients.
This feels like a massive conflict of interest.
That is the dark side of a fully integrated healthcare system. Kaiser is the hospital, the doctor, and the insurance provider, all under one single corporate roof.
Right.
When the entity providing the care is the exact same entity paying for the care, there is no independent advocate for the patient.
So the financial logic of the boardroom ends up uncomfortably close to the bedside.
Exactly.
Well, if financial logic can dictate individual care so aggressively, how does that apply to massive public health mandates?
That's a big question.
Because the sources transition from the structural fraud right into the specific, highly contentious controversies surrounding COVID-19 vaccine policies.
Right. And this is where institutional inertia really collides with shifting federal science.
Yeah.
The documents detail how Kaiser suspended 2,200 employees across the country who refused the COVID-19 vaccine, placing them on unpaid administrative leave.
But simultaneously, and this is the part I really struggle to wrap my head around, there's a lawsuit in the stack where Kaiser refused to give a non-live COVID vaccine to an immunocompromised patient.
Yep, the contradiction is glaring.
The documents say this patient requested it multiple times. The doctors noted her desperate requests, but the bureaucracy just denied her. She ultimately contracted the virus and passed away. How does a system fire healthy nurses for not getting the shot, but deny the shot to a vulnerable patient who is begging for it?
It represents a rigid bureaucracy that simply cannot process nuance.
Yeah.
But the larger conflict happening right now in early 2026 is a massive jurisdictional war. The landscape has completely changed at the federal level.
Yes, the sources call this the Kennedy schedule.
Right.
Under the new Federal Health and Human Services and CDC leadership, COVID-19 vaccines have been downgraded. They were stripped of their universally recommended status for children and moved to a shared clinical decision-making model.
Which is a huge shift. And importantly, the federal government also stripped away the financial bonuses that were previously given to hospitals for mass vaccination campaigns.
Yet, organizations like Kaiser are continuing to recommend universal vaccination, basically ignoring the new federal guidelines.
Exactly.
If you are listening to this and wondering why your doctor seems so rigid about a certain treatment plan while the news was saying something else, this is exactly why. What is driving this disconnect?
What's fascinating here is that large health systems are caught in an unprecedented tug of war.
Okay.
On one side, the new federal guidelines are aggressively pushing for medical autonomy and individualized risk assessment.
Right.
On the other side, you have state-level entities like the West Coast Health Alliance in California demanding universal compliance.
Wow.
Add to that, Kaiser operates its own vaccine study center. They have been institutionally invested in this specific technology from the very beginning.
So it's hard to pivot.
It's exactly. Changing course now means confronting years of their own internal policy and potentially exposing themselves to massive liability.
But if the legal and bureaucratic walls were so high, what finally forced the federal government to change its stance on these mandates in 2026?
Well, it comes down to the data.
We are now going to dive strictly into the provided medical literature and government data from 2025 and 2026 that fueled this shift. And again, as a reminder, we are acting simply as a narrator here, reading the data straight from the peer-reviewed studies and FDA releases provided in our source stack.
Just reading the numbers.
Exactly. So what did the retrospective data actually show?
The shift was driven by data that simply wasn't available during the initial rollout.
Right.
The sources highlight a major 2025 analysis of the V8-ERS database. That's the Vaccine Adverse Event Reporting System conducted by researchers McCullough and Thorpe.
Okay.
They specifically looked at safety signals for neuropsychiatric conditions post-COVID vaccination. And to understand this, you need to know how the CDC and FDA measure risk.
Yeah, please explain that.
They use something called a proportional reporting ratio, or a PRR.
Can you break down what a PRR actually is for those of us who aren't pharmacologists?
Sure. Think of it as a baseline comparison. A PRR of 1 means the adverse event is happening at the exact same rate as a baseline, like the standard flu vaccine.
Okay, that makes sense.
The FDA and CDC consider a safety signal to be officially breached, meaning they need to investigate immediately if the PRR hits 2.
So just double?
Right. That means the event is gotten reported twice as often as the baseline.
Okay, so a PRR of 2 is the alarm bell. What were the numbers in the McCullough and Thorpe analysis?
For cognitive impairment, the PRR was 118.
Oh my God.
For general psychiatric illnesses, it was 115. And for suicide and homicide risk, the PRR was 80.1.
Wait, 118, as in 118 times the baseline rate?
Yes.
That is a staggering safety signal breach. How is that biologically possible?
The mechanism is detailed in another provided study. It's a 2021 review by Seneff and Nye. They explain that the lipid nanoparticles used in the mRNA vaccines are specifically designed to cross natural biological barriers to deliver their payload.
Right, to get into the cells.
Exactly. And this includes crossing the blood-brain barrier. The concern outlined in the review is that these nanoparticles can carry the spike protein, which is highly inflammatory and toxic, directly into the central nervous system.
Triggering these severe neuropsychiatric events.
Precisely.
Wow. And the sources also include official FDA safety label updates for the 2023-2024 vaccine formulation. What did the FDA officially acknowledge regarding cardiac risk?
The FDA acknowledged an unadjusted crude risk of myocarditis, which is heart inflammation, at 27 per million in young men.
Okay.
But the critical detail in the sources is the mention of persistent late gadolinium enhancement.
I saw that term scattered throughout the medical files. What is late gadolinium enhancement and why is it so alarming?
So late gadolinium enhancement is a specific finding on a cardiac MRI. It is a known objective marker for myocardial injury and permanent scarring on the heart tissue.
Permanent scarring.
Yes. The FDA data showed that in patients who were hospitalized with a vaccine-induced myocarditis, this scarring wasn't just temporary inflammation. It was common and persistent months later.
And reading further, it's clear the virus itself leaves a profound wake, too.
Oh, definitely.
There is a meta-analysis by Badenoch looking at persistent post-COVID symptoms up to 6 months out.
Yeah, the Badenoch study found high rates of long-term suffering. They documented sleep disturbances at 27.4%, profound fatigue at 24.4%, and objective cognitive dysfunction at 20.2%.
When you get all these numbers side by side, a PRR of 118 for cognitive issues, the FDA's own late gadolinium enhancement findings showing permanent heart scarring, how did this go unnoticed during the initial rollout?
It really comes down to the fundamental nature of an emergency use authorization, or EUA.
The fast track.
Right. The EUA framework legally allowed manufacturers to bypass standard multi-year clinical trials and standard good manufacturing practice inspections in the name of speed.
Because it was a crisis.
Exactly. During the acute crisis, the bureaucratic focus was entirely on short-term efficacy. But now, in early 2026, we have years of retrospective data.
And the picture looks different.
Very different. The actual risk-benefit ratios, particularly for demographics that were already at low risk from the virus, like young, healthy men, are fundamentally altering the scientific consensus.
So when the science shifts this dramatically and the systemic fraud we talked about earlier is exposed, how does society react? Like, where do patients even go to seek recourse?
That is incredibly difficult. And it's being described in the documents as a legal civil war.
A civil war.
Yeah, and the central battlefield is a law called the PRP Act.
The Public Readiness and Emergency Preparedness Act.
Correct. Under this law, federal agencies and vaccine manufacturers were granted nearly total blanket immunity from liability for any harm caused by these medical countermeasures.
You can't sue them.
It is a massive legal shield. You cannot just sue a manufacturer because you were injured. The only way to pierce that shield is to prove willful misconduct or the fraudulent, deliberate concealment of safety data.
That sounds like an impossibly high bar. I mean, how does anyone prove willful, deliberate misconduct against a massive federal or corporate entity?
That is exactly what the new investigations are trying to do.
Okay.
The sources reference a massive 520-page final report from the House Select Subcommittee on the coronavirus pandemic, which was issued in December 2024.
I remember that being in the stack.
Yeah, and the legal documents refer to this report as a prosecution roadmap.
Wow, a roadmap. What did it document?
It officially documented that sweeping mandates, like the 6-foot social distancing rule, were completely arbitrary and not based on science.
Just made up.
Basically. It also noted that officials flip-flopped on face mask mandates without any underlying data proving masks reduced the spread of respiratory viruses.
Well, and the report gets into the testing too, right? Like the PCR tests.
Yeah, the high cycle thresholds. They were using PCR testing for diagnostic use instead of just for investigation, which completely skewed the understanding of the spread.
And the investigations aren't just domestic, they've gone global. The files mention active legal coalitions looking into Dr. Fauci and other officials. What are the specific allegations there?
The core allegation is the deliberate suppression of off-patent alternative treatments, like ivermectin and hydroxychloroquine.
Okay.
The legal theory in the files is that suppressing those alternatives was legally necessary to maintain the emergency use authorization for the vaccines.
Wait, really?
Yes. By law, an EUA can only be granted if no adequate approved alternative exists.
So the argument is that if they admitted an alternative worked, the EUA for the multi-billion-dollar vaccine rollout would have been legally voided.
Exactly. This is why the investigations are focusing relentlessly on financial conflicts of interest and the potential deliberate concealment of risk.
That makes total sense now.
Right. If these legal coalitions can prove willful misconduct or fraud regarding the EUA, the PrEP Act immunity collapses entirely.
But the institutions that built these mandates aren't just quietly stepping down.
No, they are fighting back.
The stack shows that in February 2026, a coalition of 15 states, led by California, filed a massive lawsuit against the federal government. They are claiming that the new HHS is acting unscientifically by dismantling the vaccine schedule and removing these mandates.
It's a huge clash.
It feels less like a medical system and more like two completely incompatible operating systems.